I grew up in Africa, in Nigeria. Right from the onset, I think from elementary school, I get fascinated by things.
Abba, dare yayi ya kamata ka shigo gida.
To kawo.
My primary dream and goal was to really be an astronaut and go to space. And, imagine that one day, someday, I get there. And that's how the story started. Stem cells are the seed of life. They are present in every organ in our body. We want to send stem cells to space to study their behavior and characteristics in microgravity environment. My name is Abba Zubair. I'm transfusion medicine and stem cell therapy medical director here at Mayo Clinic, Florida. I can see the cells are more towards... Currently, the work I do is to find new therapies to treat patients with stroke. Stroke is among the top 5 causes of death in the world. We don't have a treatment that stimulates neuroregeneration, so they end up with significant disability after the stroke. So the cells that we are interested in, which are the mesenchymal stem cells, they secrete factors that stimulate brain cell regeneration. We can grow this type of cells on us, but it takes quite some time. It takes months to get enough cells to grow. So one of the things we're doing is to look at what are the important elements that play a role in our entire biology, which is gravity. Gravity really defines how we look, how our cells divide, the shape of our organs. So you can say gravity is the holy grail. So we want to harness that effect of the gravity. If you take that out, would these cells grow faster? And that's really the premise. We want to see whether we can grow stem cells at a faster rate in a safe way so that those cells can be brought back to Earth and be used for human application. So we wrote a grant, and we are one of the only 3 projects selected to be taken to the space station. Currently, we are in the process of a study using as-grown stem cell to treat patients with a special type of stroke called hemorrhagic stroke. When the cells that we are growing in space comes back, we would treat similar type of patients so that we can compare how effective cells grown in space are compared to the ones grown on Earth. There are so limited opportunity to fly to the station. There's only SpaceX here that can carry any cargo, not people even. So we've been waiting for more than 2 years now to get this opportunity. So you can tell I couldn't be more excited knowing that this is coming so close to the launch. This couldn't be any better. The work I do is to find new therapies to treat patients with stroke. Why stroke? There is personal reason and there is scientific reasons. My dad died when I was 5, and my mom developed hemorrhagic stroke, which eventually ends her life. These are life-changing events for me, and I don't want anybody to lose their loved ones, especially the way it took away my mom.
T-minus 10, 9, 8.
And
7,
now
6,
my feeling is a piece of me going to space.
2, 1, and lift off of the Falcon 9 to the space station.
I think Mayo Clinic is like no other place.
Vehicle now going transonic through the sound barrier.
Mayo's strength is the ability to take a basic research idea and translate it to patient care. I don't think there's any place as capable as Mayo Clinic. We are doing this research knowing that there are people right now waiting to have this therapy. So I feel blessed to be here and take this opportunity to make my dream come true.